Welcome to The Explainer. Today, we're diving into a topic that is deeply personal for a lot of you out there. Retinitis pigmentosa, or RP. Look, if you or a loved one just got this diagnosis, it's completely natural to feel anxious. It's a really complex condition, and the unknown, well, that can feel pretty overwhelming. But today, we're going to walk through the science, the facts, and the future of RP together. We'll look at exactly what the source material tells us about how it works, how doctors track it, and, crucially, what you can actually do right now. You know, when patients first sit down in the specialist chair, the conversation usually kicks off with two very immediate and, frankly, really scary questions. How fast is my vision going to fade? And is there a cure? And those are entirely valid fears. While there isn't a definitive cure right this second, the medical landscape is shifting incredibly fast. By the end of this explainer, I think you'll see exactly why there's genuine reason to be hopeful. So here's our roadmap for today. We're going to start by breaking down the biology of RP, then we'll look at how doctors track vision loss, explore genetics and family risks, go over current management strategies, and finally, we'll dive into the very real future treatments that are right on the horizon. Alright, let's jump right into section 1, understanding retinitis pigmentosa, and demystify exactly what's going on inside the eye. To really get RP, we have to look at the retina, which is basically the canvas of the eye. Now, the retina is actually made up of 10 distinct layers stacked right on top of each other. RP is a progressive disease that specifically targets the photoreceptor layer, and it attacks in a very specific sequential order. First up, it hits the rod cells. These are your light-sensing structures for the dark, which is why the very first symptom is almost always night blindness. Then, as the disease progresses, it moves on to the cone cells. That's when patients start losing their peripheral or side vision, they notice drops in contrast, and colors start to fade. Finally, it reaches the deepest layer, the pigment epithelium. In advanced stages, these abnormal black pigment clumps actually gather on the retina. The optic nerve, which should be a healthy pink, starts looking yellow, and the blood vessels get noticeably thin. All of this makes everyday things, like just stepping out into bright sunlight, really difficult. So, understanding what's happening is step 1. Let's move on to section 2, tracking vision loss speed, and see how doctors actually measure this pace so patients can realistically plan for their future. It's actually fascinating how precise we can get with tracking this progression year over year. Specialists basically rely on 3 primary tests. First is the visual field test. It's a simple computer screen test where you just press a button when you see a light, and it tracks how much your side vision might be narrowing over time. Second is the OCT, or optical coherence tomography. This scans those 10 retinal layers we just talked about, specifically measuring just how thin the photoreceptor layer is getting. And third is the ERG. This measures electrical flow. Think of it like an ECG for your heart, but instead it maps the electrical currents right in your retina. By running these tests every year, doctors can note the exact speed of the condition, giving you the hard data you need to plan your life. And that brings us to a really heavy concern for a lot of folks in section 3, genetics and family risks. We're going to look specifically at the genetic blueprint of RP and the risk of passing it on to your kids. Here's the thing, RP isn't just one simple genetic glitch, it's incredibly complex. In fact, defects in over 100 different genes can cause retinitis pigmentosa. That massive variety is exactly why finding a single, universal cure has been such a monumental challenge for researchers. So how does this genetic complexity actually transfer across generations? Well, there are 3 main inheritance patterns. Autosomal dominant carries a much higher chance of being passed down to your children. Autosomal recessive has a lower chance. And then there's X-linked recessive, which specifically affects the X chromosome and tends to impact males in the family line much more frequently. Because of all this variety, specialists strongly recommend getting a gene analysis. Pinpointing your exact genetic pattern gives you a much clearer, individualized picture of your family's actual risk. Alright, let's transition into the practical side of our explainer with section 4, current management and lifestyle, focusing on what patients can do right now to fix what we can today. While we wait for a definitive RP cure, we absolutely have to focus on what we can fix today. RP frequently brings some associated conditions along for the ride, and treating these can give you immediate, significant visual benefits. For instance, if a patient develops cataracts, well, that can be treated with standard surgery and lens implants. Simple refractive errors, those can be corrected with a proper glasses prescription. And if there's swelling or slitting in the back of the eye, a condition called macular edema, that can often be managed pretty effectively with specialized eye drops or oral medications. The immediate priority is always maximizing the vision you currently have. Now, there's been a major shift in medical advice that you really need to be aware of. For a long time, high-dose vitamin A and vitamin E therapies were the standard prescription to slow down RP. But recent data clearly shows that excessive vitamin A is just not effective for long-term progress. The medical community has definitely moved away from this outdated myth. So it's really important not to rely on heavy vitamin supplementation thinking it's going to halt the disease. We also need to talk about the sci-fi dream of the bionic eye or artificial eye implants. Look, it sounds amazing, but we need to manage our expectations based on current reality. Bionic eyes just aren't a standard fix or a viable option for most patients right now. They're strictly for cases of near total blindness. And honestly, even when they are implanted, they don't restore normal vision. They generally only provide basic light perception, maybe just enough to help someone navigate a room with a cane. So, contrasting that bionic eye reality with practical solutions, how do you redesign your lifestyle right now? You turn to low vision aids. These are highly practical, currently available tools that genuinely make daily life so much easier today. We're talking about high-powered magnifying glasses, digital enhancement devices that enlarge and change the contrast of screens or text, and telescopic glasses. These tools are absolute game changers for empowering patients to keep their independence and tackle day-to-day activities while medical science keeps working on the bigger picture. Which brings us perfectly to the climax of our explainer. Section 5. Future Treatments and Hope. We've talked about the hurdles, but now let's look at the incredibly illuminating and very real future of RP research. Gene therapy isn't just some far-off concept anymore. It's a reality, even if a highly specific one right now. Remember those 100+ genetic defects we talked about? Well, right now, if your RP is caused by a defect in the RPE65 gene, there's actually a one-time surgical treatment available today that significantly helps. Plus, trials for X-linked recessive genes are showing some highly promising initial results, and researchers are hopeful that treatment could be available in just 3 to 4 years. The catch, of course, is that gene therapy has to be developed one specific gene at a time. But what if we didn't have to fix the specific broken gene at all? Enter optogenetics. Researchers are calling this one of the most brilliant mechanisms currently in development. Optogenetics totally bypasses that dead or dying photoreceptor layer entirely. Instead, it stimulates the healthy bipolar cell layer sitting just above it. Because it completely skips the damaged area, it's what they call gene agnostic. It just works around the problem, meaning it could potentially help patients no matter which of those 100+ genes caused their RP in the first place. And the results coming out of the Phase 2 trials for an optogenetic therapy called MC001, they are incredibly encouraging. At the 100-week mark, so roughly 2 years into the trial, about 50% of patients experienced a massive breakthrough. Patients who had almost no vision at all actually gained 2 to 3 lines of vision on a standard eye chart. And while the other 50% didn't see significant gains, the fact that completely blind patients are reading lines of vision again makes this literally one of the most promising horizons in retinal research today. And there are other really hopeful horizons right behind that. There's an experimental compound called nacamide currently in Phase 3 trials. Early data suggests it might successfully slow down the speed of the disease, and we might see it become available in the next 1.5 to 2 years. Further out, researchers are actively exploring stem cell therapies to regenerate the retinal pigment layer, and even CRISPR technology to literally edit and delete those defective gene segments. Now, stem cells and CRISPR are still strictly in the experimental stages, but they really represent the sheer volume of science fighting for a cure right now. Well, we've covered the biology, the testing, the genetics, and the incredibly bright future of emerging treatments. Retinitis pigmentosa is undoubtedly a heavy diagnosis, but the landscape of hope has absolutely never been clearer. So, I'm going to leave you with this thought. While science races to rewrite our genes and restore our sight, how will you proactively use today's low vision aids to redesign your lifestyle? Thanks for joining me on this explainer, and stay genuinely hopeful for tomorrow.